hearing a lot about clinical trials that are available to patients. Do you find that patients research whether they're eligible for a clinical trial and then find that it's just simply too far away from where they live to get onto that clinical trial?
Yes, that is a concern, and certainly the search itself can be overwhelming because there are so many stipulations, on the clinical trial, and it's very hard to navigate. But yes, distance is definitely an issue with clinical trials.
And trying to balance up for patients who are on these medications who clearly need quite a lot of surveillance. How do you counsel people about the benefits of being close to home with facilities that are easily accessible for regular follow-up versus travelling further afield, which may come at great cost and time and effort for family members to take patients, but they're in a centre of excellence? How do you balance out expertise versus convenience of local gynecologic care for these kind of cancers?
Yeah, and that's a really difficult thing to counsel because it really comes back to the individual. Do they have the means to even travel for all of the study requirements? And are they healthy enough to do that travel? Do they have a caregiver who would be able to go with them to be their support system? Or, is it better for them to stay close to home and manage their care in that way? So there's a lot of moving parts, and it's not just an easy answer, but they really need to talk not only with their healthcare providers, but also their caregivers, and they really need to work as a team to make that decision.
I'm just going to end the segment by asking Michelle and Dr. Secord, we've heard a lot about how there's these organisations to help direct patients to the right care, and various facilities are putting a lot of their information and clinical trials online, and even organisations like Cure Connections. We have a wealth of information that patients can access from all over the world. Patients today are very different in terms of the knowledge of their disease and educating themselves than they were 25 years ago. How helpful do you think it is for patients to come to their physicians with ideas about, am I eligible for this? Have you read this article? And how dangerous is the information out there? Does the information that's on the internet cause more harm than good? Do you think it's helpful for patients to get on Dr. Google and try and do their own research through various organizations?
I think it depends on where they're searching. Michelle alluded to this earlier.
Yeah.
When you got on the internet and started looking at things, it sounded like it was a distressing experience and not helpful for you.
For me, it's not helpful. I mean, in my situation, and when I go to Dr. Secord and she says, okay, this is what's happening now, these are our options. And she explains very clearly, sends me home with documentation. Then I will go home and research it and do Dr. Google. And then I go on a couple of Inspire is a website for women going through what I'm going through, ovarian cancer, and I read their stories, and some of it's positive and some of it's negative. So I think it's just based on your individuality, what you feel comfortable doing.
And also
for me, I don't want to know every single day that I have cancer. I try not to let that be defining me or the elephant in the room. But
and also the information you're getting from Dr. Secord is specific to you, whereas what may or may not be on the internet is more generic.
Yeah, I mean, I would rather take her advice than go home and start drinking carrot juice 24/7, because I've been told that helps cancer too, but I'm not going to do it. I'm going to take her advice and.
Yeah, I think if Pure Connections, for instance, Force, SGO, Foundation for Women's Cancer, Ovarian Cancer Research Alliance, I mean, these are all reputable internet sources. So I would be cautious of what sites you enter, but there are some very informative sites. And what Force is doing with clinical trials is really important because the clinicaltrials.gov site for patients to search is overwhelming, to say the least, right? So this is a great opportunity for patients to get access to that and have a support system to help them navigate through it as well.
A lot of it's confusing because I don't speak doctor speak. So looking at a lot of this stuff, we have no clue. If I do find something, I'll come back and ask you, well, what about this? Or like turmeric was a recent discussion at your office. A lot of people are taking turmeric, but it might interfere with your chemo drug, so I'm not taking it then.
We've talked a lot today about so many different treatments and have really just touched the surface of efficacy, of potential side effects, of the value of where the treatment's going. But in a 15-minute consultation where patients have a lot of fear and anxiety and can't always process everything they hear in a 15-minute consultation, it must be very difficult to counsel a patient appropriately without overwhelming them in such a short period of time.
So we work as a team, and so when you come to our office, you're probably seeing at least 1, 2, 3 people, maybe even 4 before you see me. Our social work staff, our nursing team, and then me again. So it's not just one person providing that care. It's probably about 7 people at the very, at least that you're seeing when you come to our clinic.
And even the volunteers that walk around are wonderful.
Right. So you have all this different access to information, and then our patients get an after visit summary that has information on there how to reach us. And there's also through Epic, our electronic email, our electronic medical record service, patients can reach out and email me questions. So it's a very open process, and we actually talk about the fact that this is so much to think about right now. You've gotten a lot of information. Go home, digest it, reach out and let me know what you'd like to do. So we've had that conversation more than one time.
Which I think is why it's so important when patients are going to see the doctor that they do take a loved one with them, to second pair of ears, to remember some facts that the patient themselves may not remember. Greg, you've travelled this journey with Michelle, and I'm sure you have a wealth of information and expertise as a result of going along to consultations.
I have knowledge, some.
Sure. Well, thank you to the whole panel. I really appreciate the input that we've had today. And Dr. Secord, it sounds like the future for patients with ovarian cancer is much brighter than it was even a few years ago with these new drugs that are now FDA approved. And it's very exciting to hear that there are still many ongoing trials that will hopefully help get more drugs FDA approved for patients with ovarian cancer. Diane, thank you so much to you for sharing your expertise today and all the work you do with FORCE to help patients with ovarian cancer and how to get help for genetic mutation testing. Michelle, thank you once again for sharing your story and helping patients connect to get the right information. Thank you so much.
Thank you.
Thank you for having us.